Well, good morning. Welcome, everybody. I want to say a special thank you to everyone for braving the weather to come today. This is a long-awaited workshop, and we're very, very pleased to have you with us, and we're very pleased to have this excellent panel of speakers today and tomorrow. I want to open the workshop by introducing Dr. Shari Barkin. Dr. Barkin is the William K. Warren Family Foundation Chair in Medicine and Professor of Pediatrics at the Monroe Carell Jr. Children's Hospital at Vanderbilt University. Dr. Barkin is also a member of the Board on Children, Youth, and Families, and she is the chair of the planning committee for this workshop activity. And I want to say that she was instrumental in initiating and developing this workshop from the very beginning. So we're very grateful to her for that contribution. Shari.
Good morning, everybody. We are delighted that you're here today, and I would like to first welcome you again on behalf of the Board of Food and Nutrition, our director, Ann Yachtine, whom you heard from. She has been really a tireless advocate and supporter to develop this fantastic day-and-a-half workshop that we are delighted that you're joining us for. Now, what we'd like to do over the next day and a half is really explore the emerging science so that we can better understand this dynamic relationship between genetics, environment, and early childhood development on the risk of obesity. Just a few more thanks. I've been honored to serve as the Planning Committee Chair alongside a group of dedicated, smart colleagues. And I'd like them to just stand for a moment so we can acknowledge and thank them. If you would please, Leanne Birch, Steve Daniels, Issa Davis, Matt Gilman, Deborah Hare-Joshu, and Karen Lillycrop. Please join me in thanking them. Well, this is not an Academy Awards speech, so I won't be thanking my husband, although I do thank him. What I would like us to do is we are a group of diverse listeners in this audience today and via the webcast. And so I'd like to provide some basic underpinning, which really provides the foundation for the workshop and everything you're about to hear. So consider that we have between 22 and 24,000 active genes, but Pinot Noir has 29,000. So more doesn't necessarily mean more functional complexity. Consider also that our genetic code is a record of our past. We talk about these active genes, but we have more than 120,000 silent genes. And our genes clearly are a record of our present, but what determines our future? And if 99.9% of all human beings have the same genetics, why do we have so many differences? DNA is a code that requires context, and so we layer on top of genetics environment. And to highlight this story, I'd like to introduce the case of the European bees versus the killer bees. So in some really elegant work, larvae from the docile European bees hives were translated and moved and raised in the African killer bee hive. Now, not surprisingly, the phenotype of that larva as it then developed into a young bee was the same, aggression. But what was surprising was that the actual expression of genes had changed. So some refer to this as the social life of genes, and the social life of genes can be short or it can be long. So now applying this into the context of people and children and layering on development, we have good data to show that if you have rapid infant weight gain in the first 6 months of life, that this is strongly associated with complications in early adulthood, obesity, insulin resistance, metabolic dysfunction. And in fact, in that study that I was highlighting, rapid infant growth was just crossing 1 centile. So raise your hand if you're a clinician, if you see patients. I know that there's some of you out there. Yes? So what we see in clinic is the crossing of not just 1 centile, but many centiles in infancy that continues then in toddlerhood. And in fact, for premature infants and those born small for gestational age, we actually prescribe rapid infant catch-up growth. So how should we consider this? Now, the field of epigenetics was actually, the notion of it was discovered before we knew the double DNA helix. And epigenetics really is the notion and now an emerging field of understanding changes in gene expression via post-translational and post-transcriptional modifications. So basically, we're asking these questions and trying to understand the emerging science. Well, you can't change your genes, but you can change your gene expression. And we are indeed built to be permeable, fluid beings rather than solitary, unitary isolates. And this leads to what David Dobbs in the Pacific Standard called the recursive reconstruction of the self. We're constantly remaking ourselves and turning ourselves over. This is an opportunity as we think about our workshop objectives. So we come together in the next day and a half so that we can identify epigenetic mediated relationships between exposure to risk factors during sensitive periods of development, specifically gestation through age 3, and subsequent obesity-related health outcomes. The second objective is to explore the science around periods of plasticity and potential reversibility of obesity risk in the context of early childhood development. And third, to examine the translation of epigenetic science to guide early childhood obesity prevention and intervention to reduce obesity risk. And the way that we'll do this over the next day and a half is through a series of 5 sessions. I like to think of them as chapters. Chapter 1, the role of epigenetics in pediatric obesity. You'll get a conceptual overview. Chapter 2, etiology and causal inference. Chapter 3 will be opportunities then for intervention and prevention. What does this emerging science show us? Chapter 4 is, why does it matter? What are potential real-world applications? And Chapter 5, data gaps and future directions. What we have done as a planning committee is tried to give you an infographic to put this together. This is not intended to be a comprehensive conceptual framework. It is your personal workshop framework so that you can understand how these multiple elements that you're about to hear fit together to weave the narrative so that we understand what this emerging science is telling us and where we need to go next. So along this x-axis is childhood development and this consideration of plasticity and reversibility as we're thinking of potential prevention and intervention strategies. Along the y-axis is the multi-level environment from metabolism and physiology to level of child, family, community, and environment. You'll see that throughout this and throughout the course of the next day and a half, the main thing we want you to understand and participate in discussing is how these things are dynamic and change over the course of a child's life, and how this can shed light on where we could focus for the potential of prevention for childhood obesity. Thank you. And now I am delighted and quite thankful for our sponsors. This workshop is sponsored by the USDA, the American Academy of Pediatrics, and the Robert Wood Johnson Foundation. You're going to hear from all 3 of our sponsors and their perspective on our objectives and the topic of this workshop. First, you'll hear from David Clearfield. He's the National Program Leader for Human Nutrition in the Agricultural Research Service of the U.S. Department of Agriculture. And in this role, he has responsibility for the scientific direction of the intramural human nutrition research conducted by the USDA laboratories. Dr. Clearfield is representing the USDA ARS as a co-sponsor of this workshop. Next, you'll hear from Dr. Sandra Hasink. She's the president of the American Academy of Pediatrics and chair of the AAP Institute for a Healthy Childhood Weight Advisory Board and Steering Committee. Dr. Hasink has collaborated in basic research efforts in identifying pathophysiologic mechanisms of obesity, centering in the role of leptin. She is representing the American Academy of Pediatrics and is a co-sponsor of the workshop, the AAP is. And then you'll hear from Jamie Bussell. She's the program officer in the area of childhood obesity and vulnerable populations with the Robert Wood Johnson Foundation. She directs initiatives that foster multidisciplinary partnerships and systems-level changes strategies to transform the health of people and communities. Ms. Bussell is representing the RWJ Foundation. We're delighted, and I'd like you to join me in thanking our sponsors.